Chikungunya is a viral disease that is primarily spread to humans through the bite of infected Aedes mosquitoes, which are also known for transmitting dengue and Zika viruses. The disease gets its name from a word in the Kimakandi language, meaning to become contorted, referencing the stooped posture of those suffering from severe joint pain, a hallmark symptom of the illness. Although chikungunya is rarely fatal, it can cause significant discomfort and, in some cases, lead to prolonged disability due to chronic joint pain. Chikungunya is most common in tropical and subtropical regions of the world. Large outbreaks have occurred in Africa, India, Southeast Asia, parts of the Caribbean, Central and South America, and certain Pacific and Indian Ocean islands. In recent years, some local transmission has even been reported in areas of the United States, such as Florida, Puerto Rico, and the U.S. Virgin Islands, reflecting the expanding range of the Aedes mosquito. The course of chikungunya disease typically begins suddenly. After someone is bitten by an infected mosquito, symptoms usually appear within 3 to 7 days. The most prominent feature is a high fever, often accompanied by severe joint pain. This pain can affect multiple joints throughout the body and is frequently described as debilitating, sometimes causing individuals to adopt a bent or stooped posture. Unlike some other fever-causing illnesses, the joint pain of chikungunya can linger long after the fever subsides, sometimes persisting for months or even years. In addition to fever and joint pain, other common symptoms include headache, muscle aches, joint swelling, rash, and general feelings of fatigue and malaise. Most people recover fully within a week, but for some, the joint pain becomes a long-term problem, significantly affecting quality of life. It is important to note that chikungunya is rarely life-threatening. Severe complications and death are uncommon, and most cases resolve on their own. However, the disease can be particularly hard on older adults, newborns, and those with pre-existing medical conditions who may experience more severe symptoms. Diagnosing chikungunya can be challenging, especially in regions where other mosquito-borne illnesses such as dengue and Zika are common. Since these diseases share similar symptoms, a sudden onset of fever and joint pain in someone who has recently traveled to or lives in an area where chikungunya is present raises suspicion for the disease. Laboratory tests are used to confirm the diagnosis. In the early stages of illness, a test called reverse transcriptase polymerase chain reaction, or RT-PCR, can detect genetic material from the virus in the blood. For those who have been sick for more than a week, serological tests can identify antibodies produced by the body in response to the chikungunya virus. Because dengue and chikungunya can appear so similar, and because dengue can cause dangerous bleeding in some cases, it is crucial for healthcare providers to distinguish between the two. This affects treatment decisions and helps prevent serious complications. Currently, there is no specific medication that can cure chikungunya. Instead, treatment focuses on relieving symptoms. Patients are encouraged to rest, drink plenty of fluids, and use medications to manage fever and pain. Non-steroidal anti-inflammatory drugs, such as ibuprofen, can help with joint pain and inflammation. However, in areas where dengue is also a possibility, acetaminophen is recommended as the first choice for fever and pain until dengue has been ruled out, as non-steroidal anti-inflammatory drugs can increase the risk of bleeding in dengue patients. While most people recover within days or weeks, those who develop chronic joint pain may benefit from physical therapy and, in some cases, long-term use of anti-inflammatory medications. Because the disease is caused by a virus, antibiotics are not effective, and there is currently no antiviral treatment specific to chikungunya. Prevention remains the most effective strategy against chikungunya. Avoiding mosquito bites is the cornerstone of prevention, especially in areas where the virus is present. This includes wearing long-sleeved clothing and pants, using insect repellent on exposed skin, staying in places with air conditioning or window and door screens, and sleeping under mosquito nets if necessary. Eliminating places where mosquitoes breed, such as stagnant water in containers, flower pots, and discarded tires, can also help reduce the risk of infection. In 2023, a significant advance occurred with the approval of the first vaccine for chikungunya by the U.S. Food and Drug Administration. The vaccine is approved for adults aged 18 and older who are at increased risk of exposure to the chikungunya virus, such as travelers to areas where the disease is common or laboratory workers handling the virus. While the vaccine marks an important step forward, it is not yet widely available for the general population, so traditional preventive measures remain essential for most people. Chikungunya highlights the global challenge of mosquito-borne diseases and the importance of public health efforts in surveillance, vector control, and community education. Large outbreaks can overwhelm local healthcare systems, disrupt daily life, and cause considerable economic impact, especially in communities where people rely on physical labor and may be unable to work due to prolonged joint pain. In summary, chikungunya is a viral infection spread by Aedes mosquitoes, characterized by sudden high fever and severe joint pain that can last for weeks or months. While rarely deadly, it can cause significant suffering and disability. Diagnosis depends on a combination of clinical signs, travel history, and laboratory testing. There is no specific cure, so treatment focuses on relieving symptoms and supporting recovery. Prevention, through avoiding mosquito bites, controlling mosquito populations, and, when available, vaccination, is key to reducing the risk of chikungunya. Awareness and understanding of this disease are important for both individuals and communities, especially in areas where the virus is present or could emerge in the future, as global travel and climate change continue to affect the spread of mosquito-borne diseases. Staying informed and prepared is more important than ever.